Good afternoon and welcome to the Marine Mammal Stranding Center Facebook Live. My name is Michelle and I'm joining you today from inside the ICU to start our live patient update here at the Marine Mammal Stranding Center. And the first patient we're going to talk about is this guy. He's been in the news a lot the past couple days. This is the male harp seal that's stranded in Lavalette. We were watching this guy for 24 hours. We've been posting a lot of information on harp seals lately, but just to reiterate, these guys are typically found on the ice floes for most of their lives. They can be found as far south as Virginia and even the Carolinas in the wintertime. We typically see harp seals that are juveniles, or approximately, anywhere from 1 to 3 years of age. But occasionally, we see some of these big, beautiful adults, and he's giving you a great view right now. You can see why they're named harp seals. It's because of that beautiful black and white marking that looks like the musical instrument, the harp. So when these guys find themselves on their beaches, if they're feeling a little under the weather, if they're dehydrated at all, one of their habits is when they feel dehydrated, when they're up in the ice floes, they could just simply eat ice and snow to help with their hydration levels. Most seals get all of the hydration they need from the fish that they eat, but sometimes seals may fast, especially during breeding season, which you can imagine this big guy may have just gone through a breeding season, or maybe he was a little bit under the weather. But in either case, when he found himself in New Jersey, he confused our sandy beaches for ice and snow. So when that happens, when we have evidence of them eating ice and snow, that's when we admit them to the hospital, because we have to treat them to prevent gastric impaction, and that's when sand and substrate really just starts to back up in their digestive tract and start to cause issues. So the way that we figure out if they're eating sand or not, first off, we will observe them for 24 hours. If they're on the beach like this guy was, we'll have shifts of volunteers watching him to see if they physically see them eating ice. The second way, which when we went to capture this guy the following morning, another bit of evidence is just their mouth is full of sand. So he had a lot of sand in his mouth and in his gums. And the third way for the smaller seals that may come here for a 24-hour observation is we watch their output, their fecal output. And if there's a lot of sand and substrate, then we know that that's what they're eating and they're going to need treatment. How do you get sand out of a harp seal system? Well, one of the most effective ways is fluids and mineral oil, and that's what flushes the sand out. So that is our newest guy. He weighs in at about 150 pounds right now, so he is a big boy, a big adult male. And he's already eating on his own after he had his system flushed. We saw him pass quite a bit of sand, and he's doing pretty well. So we just wanted to pop in and give you guys an update on this guy because he's been all over the news lately. And as you can see, he's got a big old pile of ice because anytime harp seals are in the hospital, we give them ice for their comfort, to help them hydrate even more, and also for enrichment because they're used to being on ice. So our next stop is going to be Pen C. This week she's in the water for you guys. Normally she's napping in the sunbeam this time of day, but this is the female gray seal that's stranded in Point Pleasant Beach. She came up during a flood tide. She was actually in the street in the middle of the road in the middle of the night. So fortunately she was able to be rescued. She's been here for a while now. She's finished her medication, and now this upcoming week, this seal plus several others in our hospital will be getting their blood drawn again. And that is for their pre-release blood. So basically our veterinarian will take more blood, run some more panels to make sure that all of their issues have been resolved and that they're ready to return to the wild. So we're coming on an exciting time for this little girl and some others in our hospital. So obviously we'll keep you guys posted on how they do. Next up is Pen B. Pen B's sneezing a little bit underneath here. Oh, he's going to pop up now. So Pen B is from Seaside Park. Pen B was in Island Beach State Park, was pretty thin. This is the seal that was with us when our truck broke down. So he had an exciting journey to get here. So we broke down on the side of the road on the parkway and had to dispatch a second vehicle to transfer him from one vehicle to the next to get him to the hospital while we waited for a tow. But he's doing well as well. And we've got Pen A. So Pen A is the guy from Atlantic City. This is the one that's stranded in front of Ocean Casino. I'm trying to get you guys without some glare here. This is a guy that has a pretty extensive rear flipper injury. So he's dry right now because he requires more topical treatments. So throughout the day, the technicians have to handle him and get some topical medication on his injuries in addition to the oral medication that he takes. So he gets supervised swim time too, just like everybody else, but he needs to be kept dry more often to apply the medication and as well to let the medication dry and be on the wound for a while. But he's eating on his own as well. So we're going to head on over now to the pool house to show you everyone in there and give you guys some updates on how everyone's doing there. And in the pool house, our stranding coordinator, Jay, will help us pop open some of the doors just because these are the older pens and the Lexan has scratches in it, so it's a little harder. So here's Jay.
Hey, everybody.
Hi. So we are going to start here. So we have another one that's getting supervised swim time right here. And you hear a little growl, so we're going to back off a little bit because she obviously doesn't want us near her. But this is the female gray seal from Allenhurst. She's eating on her own as well, and she's one of the seals that still needs to get some supervised swim time until she gets stronger. And then in pen 3, this is the male from Ship Bottom. And he's another one. He's a little bit smaller, so he'll get some supervised swim time later on today. And he's eating on his own. Actually, everybody in the hospital right now, knock on wood, is eating on their own, so we're really excited about that. Pen 2 is a little famous. This is our entanglement survivor. She's playing with the drain right now. This is the little girl that was entangled in the plastic overwrap from a case of bottled water, and she's doing well. Fortunately, the entanglement didn't cut into her neck, so she looks great. And a lot of people have been calling and asking about her. And we'll get a quick look at Pen 1. Pen 1 is rambunctious and likes to climb around a lot, but Pen 1 is the star of this morning's video. If you guys watched our intake video of the fluffy white seal getting his initial intake exam and tubing, that's this guy. 2 weeks ago, he was fluffy and white, and now he's covered in his gray juvenile coat. He's a male, so he's dark gray, unlike the females that are that silver platinum. And then we're over to the hut, and we're going to strandings. So we're going to come on over to the hut before we enter the hut. We continue to have a busy week here at the Stranding Center with the gray seal pup season, right, Jay?
Yeah, it's been a little crazy as usual. We have quite a few animals that we've been seeing come up on the beaches just to rest. We had to unfortunately pick up 2 of them that were kind of in an area that was very busy. A lot of folks on the beach with their dogs off leash. We wound up having to remove those two animals off the beach and relocate them to a nice quiet spot. We had a couple other animals that we were watching for a bit. Wound up just going back in the water on their own the following morning. We are proud to report we had a entangled harbor seal that was entangled in some what appeared to be some gill netting about a month ago. The animal's been kind of eluding capture in this area. It's been hanging out down around the southern part of the state. We just got word last night that our partners to the south at the Merit Institute in Delaware, they managed to actually get that animal came up on a beach where it was more accessible. They were able to capture the animal, remove the gear, and kind of send him on his merry way.
Oh, that's great news to hear. So this is the guy that kept hauling out on docks and kind of figured out that we couldn't reach him on a dock.
The initial report that we got, he was actually hanging out on a boat ramp, and as soon as we got close to him, he just rolled off the edge and back in. And every time we've gotten a call on him, he's been on a floating dock, and every time we try to make an attempt, he just gets away from us.
Wow, well, that's great to hear that we captured that guy, and that the rest of the seals we've been watching out in the wild have been doing pretty well. You know, it's unfortunate that we do have to sometimes relocate seals, but we have to do it for their own safety, you know, because we don't want them to get injured by a dog off leash, or, you know, just really disturbed to the point that they're exhausted. So what should people do if they see a seal on the beach?
If you spot one on the beach, like we tell everybody all the time, always give us a call. Let us know. We can take a look at it. We can get a volunteer down there to check on it, make sure it's healthy. And if it needs to get picked up, we'll pick it up. Otherwise, we'll just observe from a distance over time, and hopefully they'll move on if they don't need any assistance.
That sounds great. Remember, we always want to save 609-266-0538 in our cell phones. All right, so we're going to check in on our last patient. Thanks so much, Jay. So we're in the hut, which is kind of our overflow building. This was previously, we were nicknaming this the CIL City building, because as of last week, everybody here was from CIL City. So this is our male from CIL City. He's doing well. He's one of the other seals that's just about ready to get his next set of blood work to prepare for release. So we're excited for this guy. And our female from CIL City, here she is. She is also ready for her repeat blood work, so we're pretty excited about that. So what happens is our vet will come here, we'll schedule blood work for everybody that's finished medication and has been off of medication for at least 2 weeks. We'll take blood, we'll tag them on the rear flipper with an identifying tag, and then they'll move to the pool once our vet clears their blood work, and they will be ready to prepare for release. And then last but not least, this is our little girl from Delaware. She actually was in the pool, she was in the ICU the last time you guys saw her on an update, but we moved her in here because the big Harp needed a pen to go to, so she was moved over here. So this is the girl that stranded in Bethany Beach, was really underweight, had a little bit of lanugo, and now she's looking pretty spunky and eating on her own. Well, I want to thank you guys so much for joining us for our Facebook Live this week. Thank you guys who have been just sending words of support. We appreciate everybody that's been donating just from our Facebook posts on our website and Instagram, and also those folks that have been sending in donations from our Amazon wish list. All of that keeps us going, so we thank you guys so much. We hope you have a wonderful day and take care. Bye-bye.